If you didn't know, it is Heartworm Awareness Month, and more than 1 million pets in the U.S. have heartworms. In this week's Animal Answers segment, we welcome back Tiffany Burk to the show to share how this disease can be prevented, and prevention is key here. Are you going to show any pictures of heartworms, though? They're pretty gross little buggers.
Yeah, they are the most nasty of all. They are very gross, they're dangerous, they're life-threatening, and they're transmitted by the tiniest of all of the bug creatures out. And with it being so warm, especially today, mosquitoes are out, they're looking for a meal, and that is our carrier for this nasty, disgusting, spaghetti-like worm.
Yeah, so the mosquitoes carry it. What does this disease do to an animal?
Well, it affects cats, dogs, ferrets, small mammals, and it can cause death. So I hate to open the segment with something so sad, but it is life-threatening if not prevented every month, okay? Our indoor cats are potentially at risk, our outdoor cats. Dogs go inside and outside even if they're only using the bathroom because mosquitoes can fly in our house. They can
still
fly
need
out
to be treated
every 30 days.
Well,
yes.
It's in the name, heartworm disease. Is that what these worms do? They attack an animal's heart?
Yes, they do. They live actually in the right side of the heart, right atrium. They can also live in the lung parenchyma, if you will. These worms can get up to 12 to 14 inches long in dogs, 6 to 8 in cats, and there can be up to 200 worms in one adult dog heart at a time. Cats carry less of a burden, and it can cause congestive heart failure.
Goodness.
Lung changes, badness, coughing, and the worst thing is death if not prevented. It is treatable in dogs, but here's the big thing, it's not treatable in cats.
Wow, okay, that's a lot to take in there.
Yeah, sorry.
No, it's fine, it's an important topic. What are some of the symptoms, though, that you should be on the lookout for?
Yes, well, some of these patients are asymptomatic, so that means no symptoms at all. Some of our cats are quiet carriers, meaning they won't display any symptoms. Let's talk about cats for a minute. Some cats can have a mild hack or cough, can sound like asthma or bronchitis, and it can actually be heartworm disease. Even if you prevent it, every couple of months they can still acquire it. In dogs, it can be, again, asymptomatic, mild to moderate cough, lethargy or not acting themselves, abdominal swelling where because their heart's not pumping well, fluid can build up, back up, and go into the abdomen or belly, if you will. So there's a menagerie of symptoms from nothing to major and life-threatening.
All right, well then let's focus on treatment then. You know, we've already established it's important to treat your animals. How do you do that?
Treatment, so treatment's not around for kitty cats, it is there for dogs. It is a series of injections which can cause reactions. Treatment is non-problematic causing. It can be treated with injections. We typically stage our patients before we treat them, take x-rays, blood work, make sure they're not an end-stage heartworm disease, and it is a multi-month process. These pets have to be activity restrained where they're not running or jumping or playing after the injections, because as these adult heartworms are dying from these injections, they could get dislodged and cause allergic reactions. So if your pet does have heartworm disease, it is treatable for dogs. It can come with reactions. We do treat them with medications prior to lessen our reaction potential, but it's not just a quick and easy fix.
But bottom line, be proactive and be giving your heartworm medication, right?
Yes, and it's very easy. There's topicals, there's chewables, there's a lot of different options out there for our furry family members now. Consult your veterinarian, discuss with them what fits your budget best, what fits your patient or pet the best, because some pets need a topical because they don't take the chewable. And remember, depending on your prevention, it's every 30 days, year round. There are treatments, there are tests for cats and dogs. So if your dog is over 7 months of age, they can be screened. We recommend annual heartworm tests for our dogs. And if you're concerned they have the disease or you've missed multiple months, call your veterinary office.
Stay on top of it. A lot to consider there, a lot of important information, but as always, we appreciate your animal answers. Thanks for coming in. There's the information on your screen as well. Again, thanks Tiffany with Bay Animal Hospital.